Hey guys, I'm Jeremy Ashburn and I've got John Clark with me, and we're at Asheville Compounding Pharmacy, and these guys provide compounded prescriptions as well as a variety of supplements to promote overall health and wellness and viability. So let's talk today about bone health. And if I'm concerned about my bone health and I want to have really strong bones and have longevity, what would you recommend there?
Sure. The first thing we always recommend to patients worried about their bone health and ways they can naturally support their bone health is to make really good choices on a day-to-day basis. And what does that mean? That means being mindful of the kind of foods you eat. One of the foods to definitely avoid are sodas. The phosphoric acid in sodas can cause the calcium to leach out of your bones. So stick to a whole foods, plant-based diet.
Can I interrupt you for a second?
Sure.
Is that going to be any kind of soda, or?
Correct. Any kind of soda, diet soda, regular soda, any of those. If it's carbonated, it's probably got a lot of phosphoric acid in it, and you should avoid it.
Okay, got it.
Other things to do: whole food, plant-based diet that will decrease levels of inflammation and provide the nutrients you need to keep your bones strong. From a supplement standpoint, we usually recommend 1 to 3 things depending on the particular patient's condition. One of the things we recommend is the calcium chelate, and what makes calcium chelate different from other kinds of calcium? They're chelated to things like other minerals that help it get absorbed into the body. So things like calcium citrate or calcium carbonate have a low rate of absorption. This one has the highest rate of absorption that we've seen, and it's because of the fact that the calcium molecules are chelated to other types of molecules that are shown to be safe. So this gets the calcium into the body. Patients might want to consider some other things like maybe vitamin D, maybe some vitamin K. But again, it depends on their specific situation, which means please come and talk to us about your bone health. We can definitely find a natural way to support your bone health and hopefully keep you off medications if that's the route you go, or use the natural supplements in conjunction with your medications.
Okay, definitely. So chelate is sort of like it makes it more active. Is that sort of?
When it's chelated and it gets into the stomach and the small intestine, the receptors on your cells recognize it as something that they need to actively take up into the body. Whereas calcium citrate and calcium carbonate just sort of passively, lazily cross the cell membranes into the body. Your cell membranes see this, and they actually use your body's energy to get it absorbed, so it increases the rate that the calcium gets absorbed into the body.
Okay.
So you're paying for a high quality product, and you're also paying for the technology to make sure it gets where it needs to be.
Definitely. And of course, in other videos we talk about quality, and one of the things to always be researching for is what is the quality of the supplement, because you've got low quality supplements you can get at a GNC or wherever that just won't be absorbed and probably be urinated out or excreted out or whatever, right?
Yeah, it really just depends, and we put a lot of work into making sure that we get things that are tested by third parties, that make sure that what's on the label is in the actual capsule that you're buying, and that they source high quality ingredients for our supplements.
Definitely. Well, you can learn more by just going to AshevilleRx.com, or you could give these guys a call or walk right into the pharmacy, and you guys are right on Merriman Avenue, and I guess sort of just north of downtown.
Yep, yeah, about 2.5 miles north of downtown. That's right, across the street from McDonald's on Merriman Avenue.
Okay, definitely. Well, thanks for your time.
Thank you, Jeremy.